Hello everyone, my name is Sue Ball and I lead the Public Library Health Group, which supports the National Universal Health and Wellbeing Library offer. For our non-library people in the webinar, this is one of 4 national universal library offers shaping the delivery of public library services. The others are reading, information and digital, and cultural creativity, and these are supported by 2 promises. My day job is Interim Libraries and Arts Manager at Staffordshire County Council. On behalf of Libraries Connected and the National Academy for Social Prescribing, I'd like to welcome you all to our seminar on social prescribing in libraries. We will be recording the seminar. Could you, if you're not muted, please, could you mute yourself? Thank you. On behalf of Libraries Connected and the National Academy for Social Prescribing, I'd like to welcome you to the seminar. We're going to be recording the seminar, so please keep your camera off if you prefer to. Also, please put your comments and questions in the chat for our question and answer session at the end. Well, the aim of today's webinar is to help libraries engage with GPs, health care professionals and social prescribing link workers, and for our health professionals to highlight how libraries can provide this support. I want to open the webinar with a definition of social prescribing. Social prescribing is a way of enabling GPs and healthcare professionals to connect and signpost patients to community activities and non-clinical services that can help to meet a patient's social, emotional or practical needs with the help of a link worker. Libraries are important destination places, providing a range of community assets in the form of services, activities and resources that can help to drive the local social prescribing offer. Through their physical and digital spaces, libraries play a key role in social providing by providing community connections and social engagement opportunities through the activities they provide and the volunteering roles available. Expert endorsed health information and resources such as our Reading Well collections and signposting to other organisations and groups and local support. Social prescribing is a key area of focus for the Public Libraries Health Group, and we're working with our partners, the Reading Agency, to look at how we embed social prescribing in our library offer. On the Reading Agency website, we have a social prescribing toolkit for libraries and an information graphic that explains how libraries can support social prescribing. The health group is also working closely with Dr Tola Dabiri, National Lead for Arts and Culture at the National Academy for Social Prescribing, to look at how we can embed social prescribing in libraries. And I'm really delighted to introduce to you Dr Tola, who's going to talk about this work. So over to you, Tola.
Thank you so much, Sue, and thank you so much also for everyone in Libraries Connected for making this webinar actually happen. I had a little joke earlier on. We've been planning this for a long time, so we really hope that you find it useful. We really hope that we know that we found working together very useful. So as Sue said, I'm the National Lead for Arts and Culture for the National Academy for Social Prescribing, very long title. What it basically means is I look for strategic interventions to promote health and well-being and social prescribing in arts and culture activities. And libraries are really definitely somewhere that's a very obvious place for me to do a lot of my work. Libraries are key in local communities, and as I'm often fond of saying, social prescribing doesn't happen up here at a national strategic level. It happens on the ground with people making connections with each other, making connections to activities and finding ways to improve their health and well-being in all sorts of ways, physical and mental. And so the work of the link worker in finding high quality, accessible, affordable activities to promote social prescribing, and social prescribing activities is key. And where else would you start but in a library? I have to confess to you, I'm from a libraries background, so I think libraries are wonderful. In our libraries, we find all sorts of activities taking place, which social prescribing link workers and other people in the community can attend to help their health and well-being. These are a marvellous array of things like knit and natter, most of you know, and that's sort of like knitting actually combats some of the symptoms of arthritis. Knit and natter groups are also wonderful ways for combating isolation and loneliness. Isolation and loneliness is actually one of the biggest health risks that we can face as we grow older. So libraries are key. There are also some very bespoke library-focused activities like the Reading for Wellness project happening in the Northeast that's run with Anne Cleves. There's lots of other things you'll hear this afternoon, like the wonderful work in women's health that's going on in the Northwest. Libraries have a range of activities. Lots of libraries have community gardens, which means that there's a lot of green social prescribing. At the National Academy for Social Prescribing, we work across 5 pillars. These are green social prescribing, physical activities, heritage, older people, and arts and culture. And although libraries fall really within the arts and culture sector, as I've just been saying, the activities that you provide fall across all of the activities that we do in libraries. So for those of you who are non-library people, check out your local library and see what's happening and see how libraries can help you to meet your challenges for your health and well-being targets for your local population. And for those in libraries, please do make connections with your local PCN. That's really what this webinar is all about. So without any further ado, I'm going to hand over to Jo Ward. Jo runs a wonderful project for women's health in the Northwest, but I think she can probably tell you about that better than I can. So I'm going to hand over to Jo now. Yes, are you ready, Jo?
I am. I'm just loading my slides, I hope.
Okay. I'll just, right, okay.
If you can let me know if you can see them, I'm just moving it onto slideshow. Well, we're waiting for them to load. Really excited to be invited by Tola today to speak to you, because I also have a confession. I'm a lifelong library advocate as well. And I really do believe that if the NHS is to deliver on the long-term plan, we can't do it without libraries. It's a key example of asset-based working. So in terms of my background, I used to work for Museum Libraries and Archives Council. I've worked for the Open University, and I've also worked for the BBC. And I've been working for the NHS in different guises for the last 15 years, but never fully in one camp or the other. I've kept my foot in arts and culture, and I've kept another foot in health, because I think it's essential in terms of maintaining the dialogue to understand the changing basically context, and also the often feeling like constant shift and change of personnel. So you make the contacts and then things change. So today's presentation will focus on 2 things. One is the Lullaby project, which Tola specifically asked me to talk about, and also the women's health strategy. I've shed loads of slides, which I have no intention of going into any detail, but what I wanted to do was to capture your imagination and whet your appetite and leave you with a repository of resources in terms of key contacts and key reports. So I had responsibility for Cheshire and Merseyside, what was a healthcare partnership, which is now an ICS, to write the women's health response to the women's health inquiry in 2021. And I was also basically tasked with producing the first drafts of the women's health strategy, which is currently being socialised with our communities. And I want to tell you a bit about those. But first and foremost, let's cut to the quick and want to tell you about the Lullaby project. So the Lullaby project came about in midst of the pandemic, and it was a project that was to address women's isolation and also to respond to the depression and anxiety that was heavily triggered and amplified by COVID, but was already pre-existing. And it's a wonderful project because actually, if it wasn't for the pandemic, I don't think it would have happened in basically Cheshire and Merseyside, because in 2020, I reached out to Carnegie Hall in New York and basically said, we know that you've got this amazing project that addresses women of colour who are being basically not given a full service in terms of health. So we have unprecedented death rates for women of colour, and there's something wrong in the system. But we understand that you've been able to utilise a music project to engage with women and children, and you're making a difference. And they kindly came back to me and said, we'd really like to work with you, and particularly the NHS. And the role I had at the time was what's called a vanguard role within the maternity services. What that means is we were given the opportunity to test out new models and ways of working, but look at basically a blueprint that we could hand over to colleagues who could then basically land on the decks running, as it were, with a project and make it their own. But quite a lot of the heavy lifting was out of the way. So the Lullaby Project is a really simple formula. We work with our community engagement teams, our libraries, our social prescribers, our midwives and health visitors to identify vulnerable women. And basically what we do is we're able to pair those women with a professional musician who spends at least 8 weeks with them to actually work through a whole process of writing a letter to their baby, and that can be their bump or their new baby. And then that provides the infrastructure to start to write a lullaby and to sing and perform that lullaby and have it professionally produced. And at the end of that process, it all culminates in performances in community venues. And what's really wonderful about the project is it works, but also it leaves us with a legacy of resources. So one of the first things that we did when we started to create and co-produce the lullabies with the mums was to speak to our local library services to say, would these resources be useful for your rhyme time and your mum sessions? And how can we make more of the resources that our amazing mums and musicians have produced? Why did we do the Lullaby Project? I'm not going to go into details, but I've given you all the references, but just 2 headlines. Maternal suicide. I often quote this and I'm asked, where do I get my data from? Well, it's verified data through the NHS and through NPEU, which is based in Oxford, who collate data nationally on both suicide rates and maternal deaths. They're quite appalling figures, really, when you think about it. Given that we are a wealthy country, but we're still not addressing issues around maternal deaths. And the Lullaby Project actually is giving real evidence that we can start to make some inroads, because it provides a platform for us to engage early with vulnerable women experiencing disadvantage, but it also helps us build trust, because we are aware as well, since COVID, for certain groups of the population, we have a real issue around trust. So again, I'm not going to go into lots of detail, but we were really privileged to work with Dr. Kerry Wilson at Liverpool John Moores, who worked with us and the mums and the musicians, and specifically Live Music Now, our national partner, to develop a theory of change. So we were very clear about what we wanted to impact on and what difference we wanted to make. And we were able to work with Dr. Kerry Wilson to actually make that very clear in terms of using scales that the NHS are comfortable with in terms of the distance travelled for the mums, the babies and the wider family. But also we were really interested in the impact on musicians, whether that changed their views about different areas they might want to go into and about their confidence working in health contexts. Again, we can share the full reports. And this is just to give you an idea of the things that we were looking at. And it was a very holistic approach. So we were really interested in mums' subjective well-being, their self-efficacy and agency, because we all know how difficult a terrain the NHS can be to navigate, especially if you're not well. But we were also looking at the creativity and the heuristic experience for the parents as well as the children. And we're able to demonstrate real improvements. And so much so that I think we're the first ever creative health project to be shortlisted for the Royal College of Midwives, basically international research project. So what we were able to do were create standardized measures of subjective well-being And I introduced these specifically because I think everyone's aware of webworms and swebworms, etc. But please do come back to the slides when they're sent over. So the other main element where I think there's a huge opportunity, and we're certainly capitalising it on Cheshire and Merseyside, is the women's health strategy. And again, not going to go into any detail, just going to encourage you to come back to the slides and to some of the notes on the notes pages where you've got lots of links. Because it used to be commonplace to say women had basically a mortality advantage. That's actually been going backwards since we hit austerity. And it's really, really problematic in many areas. And it's not going back across the board. It's just going back where women are specifically experiencing multiple disadvantage. So we can see how important the wider determinants and social determinants of health are impacting on people's lives. Lost opportunity and lost talent. And what it really culminates in is frequently women living for the years that they do have in more years of ill health. And all of it is as her solution, I should say. So the other reason that we were really interested in working with libraries around the women's health agenda is very much around health literacy, but also awareness, because at the back of our mind was that there's a need to mobilise communities and mobilise women specifically to call for change. And I think that's a superb role where libraries basically are fairly pivotal. So just to give you an idea of the challenges ahead, I mean, I was absolutely gobsmacked when I heard about the data around blindness. So who do you think that 65% of the world's population who are blind are? Well, it's women. And one of the main factors is poverty, but it's also to do with our hormonal changes and also autoimmunity system and pregnancy. And that can be changed as well. We're also aware that if women experience a heart attack within 30 days, they're basically much more likely, in fact, twice as likely to die rather than their male peers. And that's to do with us being treated as basically asymptomatic, or simply they make the assumption we have the same symptoms when we don't. We're definitely not small men, and there's definitely a mile of climbing to go, shall we say, to understand how that biology differs, how our hormones impact, and how that impacts on the efficacy of pharmaceutical treatments and also diagnosis. The other main element is that many people are very surprised to hear that the leading cause of death for women is dementia. And basically, we had a radio show this morning in Cheshire and Merseyside, which really underlined how that some of the modifiable risk factors that increase the likelihood of developing dementia are specifically factors that only women experience, and a lot of it's to do with social care. So again, some useful information in the slides. I'm hoping to energize you to want to do something about these. Now, the other big opportunity, if you want to engage with primary care networks, because I know from our libraries that we work with, is that sometimes it's very difficult to get through the door or to identify the right people. Well, if we start to think about the percentage of NHS staff who are women, which is over 76%, and if we look at health and care in general in terms of social care, it's 84%, then we can start to think about how does social prescribing potentially impact on our workforce? How can social prescribing impact on recruitment, reduce attrition, but also support retention? Because actually our staff is our public as well, and all our staff at some point in their lives are going to be our patients. So again, I'm encouraging people, and we have a specific project in the Liverpool City region with our 9 library services who are just looking at how we can actually draw our primary care networks through our basically library doors. And again, in terms of some of the main issues, the people plan for the NHS has been delayed. It's been delayed since May, but it's imminent. And there are key elements around stillbirth and around the menopause. So 19% of our workforce are basically either perimenopausal or menopausal. And libraries are in a superb position to actually help us to reach significant chunks of the population. And it's not just women, it's their wider families, because if someone's experiencing the menopause, then there are shockwaves through the whole family and through the workforce. And again, this is to just give you some of the background to some of these basically statistics, because we're talking about 19% of the total workforce. If you look at primary care networks, you can probably increase that slightly in terms of the age profile. So there's something about having a local library service working in partnership with the NHS to boost the health literacy of those people that are on their doorstep. Again, just going back to the actual national strategy for women's health, there are 6 points within the plan. I would encourage you all to think about examples of how you could contribute, because libraries are in a superb position. I'd encourage you to think about using this 6-point plan as an evidence base in the same way we've used 5 ways to wellbeing, with really concrete examples of what libraries do that could be contributing. And better information and education is obviously absolutely key. But my number one, and it is number one nationally, is better basically ways to hear our women's voices. And that's about tackling taboos. It's about building confidence. And again, libraries are in absolute pivotal places to do that. I'd also mention around poverty, in that poverty is highly gendered in the UK, and there is a whole movement within social prescribing around health justice. So seeing health as a human right, and to address some of the issues within the wider community about how we can make that a reality. And again, libraries, from my experience of working in libraries 20 years ago, that how effective are libraries as a platform and a base for specialist advice services on finance, legal advice, etc., and obviously the wealth of information they contain. And then really just to start to wind down, when we think about best start, well, I always think about libraries, rhyme time, and just the number of families that engage, and the whole focus about libraries getting to babies, getting baby library cards and getting them in for life. And that, I think, is something that we could all learn in terms of the wider healthcare structure. But what's really, really important is if we're ever to address health inequalities, we have to start at the beginning. So disadvantage starts before birth. So if we're working with our mums to encourage healthy pregnancies and healthy lifestyles, then we're making a huge basically movement towards addressing some of these issues. We know the foundations of development are laid in early childhood, and what better experience of encouraging mums and wider families and dads and grandparents to read to their children to help to boost their vocabulary, their confidence and school readiness. So just to finish off, you might be able to see the backdrop. It's Baby Week 2023. We were quite a late arrival into the Baby Week movement in terms of the north of England, which is attached to a whole movement around addressing health inequalities amplified by COVID. But we have basically embraced Baby Week, and because I used to work for museums and libraries, I was really interested in the background to it. And what I discovered back in 2022 was Baby Week actually existed during the First World War, and actually it was a huge movement around mobilising health services. So if you've not heard about Baby Week, again, you've got links to our colleagues in Leeds, Bradford, and there are 8 other partners who've come on board this year. I'd ask you all to think about a Baby Week campaign next year, and I'll leave the slides for you to have a look at. And then last but not least, as part of our work to encourage greater communication between sectors, between health and non-health partners, we produced a Women's and Children's Creative Health Handbook under the tutelage of Dr Daisy Fancourt, led by Katie Warren and myself. And so if you want to understand how the wider determinants of health impact on children and families, then there's some really useful resources and links. And so hopefully I've not gone over. Thank you for listening, but please do look at the resources when you get the slides, and do get in touch if you need any help and support. And hopefully in 12 months' time, we'll be feeding back on some of the great steps forward we've made with our initial pilot in Cheshire and Merseyside with the libraries.
Thank you so much, Jo. That was absolutely fascinating, and just all those statistics and information. And thank you for saying you could share the slides, because I know quite a lot of people have been asking about that. Brilliant, and thank you for covering so much so quickly, but also so succinctly and thoroughly. So thank you for that. I was really taken with the idea of health justice and thinking about the role of libraries in terms of social prescribing, in terms of them being a place and the activities that happen in libraries, but also the information and signposting, and particularly I know it really does tie into information literacy, which is something that we've been thinking a lot about in terms of health over the last few days, actually, interestingly. And you also talked about sort of social prescribing starting before babies are born and going through life. And so I'm really delighted to hand over next to Becky Rice from Barnardo's, who was instrumental in writing a really fascinating report, which we'll put a link to in the chat, because I think it's really useful for you to read if you haven't come across it. It's called The Missing Link: Social Prescribing for Children and Young People. So I'll hand over to Becky to tell you more about that.
Thanks so much, Sarah. I'll just load my slides up and obviously immediately lose the window that I wanted to open. Okay, I'm just going to have to start showing my slides again, apparently, because I won't find them. 1 second. Let's just say it'll be worth the wait. Let's tease it like that. There we go. If I share those and then start a slideshow, can everybody see that?
Yeah, that's come through.
Okay, lovely stuff.
That's it. Yeah, it's on slideshow. You're ready to go. Thank you.
Fabulous. Yes, thank you very much for that seamless link. I don't know if the agenda was set up to take a life course approach, but it's made it very easy for me to slot in here. My name is Becky Rice. I'm a Senior Policy Advisor in Mental Health and Wellbeing at Barnardo's. And I'm really, really pleased to be here to talk about the report that we recently published called The Missing Link, which is about social prescribing for children and young people. I'm very happy for slides to be shared. I also have a video that I should have probably brought along with me about the service that I'm also very happy to be shared. So I've got about 10 minutes. So I'll try and skip through as quickly as possible just to talk a little bit about the report, Social Prescribing for Children and Young People, our recommendations, and then talk a little bit to the importance of connecting children and young people to their communities and the potential role of libraries. So I always put this slide in, I never know if it's useful, about Barnardo's. Barnardo's is the largest children's charity in the UK. We provide 794 services and partnerships across the UK, and around 100 of those services are directly involved in mental health. So social prescribing for children and young people, there are some similarities to adults, but there are some differences as well. So much within many models of social prescribing delivered by link workers in primary care, but also in school and community settings. But I think the really important thing to get across as part of this presentation is that social prescribing for children and young people requires an approach that recognises that they are different to adults. Much as the previous speaker said, women are not smaller men, children are not smaller versions of adults. They've got their own specific set of needs. And often when they're referred to social prescribing services and referred to link workers, children and young people aren't immediately ready to be passed into those community activities and those activities that take place to support their mental health and well-being or their physical health. Children and young people often need a whole family approach. We need to understand what their specific causes of their referral are, and we need to take a whole family approach to supporting their health and well-being. And I think the key part of that is that it requires a real collaborative approach between referrers, link workers and local organisations to understand what the local landscape looks like in terms of services available to children and young people, what those barriers to access might be and how we can work together to overcome them. And the link worker is really pivotal in that role. Sorry, I've got a little bit of a cough. So Barnardo's role in social prescribing. Our services recognise and respond to the unique needs of children and young people. Our link workers have a children and young people's background and training so that they have a toolkit of how to support children and young people with a variety of different needs. Our service in Cumbria has worked with over 500 children and young people and their families, and we've recently started working in Lancashire as well. Our link workers take a holistic approach to children, young people's and family needs. They offer direct support, including activities and work to address mild mental health issues. We signpost to activities and work to signpost to services including child and adolescent mental health services, financial support and food banks. Our link workers also coordinate services and families to help navigate the education and the healthcare landscape. So that might include supporting children and young people with an autism referral, or to get special educational needs support, or for complex health needs. And where community support exists, we work to break down barriers, and where it doesn't, we work to ensure that those services are established. So that's the importance of that kind of collaborative and partnership approach again. So the missing link, sorry, the missing link report was produced with children, young people, teachers, parents, GPs and commissioners with our service in Cumbria. Importantly, we found that social prescribing for children and young people does work. It improves outcomes, it's cost effective, and it's a universally proportionate service. So children and young people have universal access to social prescribing, but the best impact and the greatest effect are felt for children and young people who have the greatest barriers to access. So in that way, social prescribing can both help to reduce the presence of and the impact of inequality for children and young people in terms of accessing support in the community, support for health services and educational support. And social prescribing also fosters connection to nature and the community. And there are some quotes from the report there, but I'm sure when the slides are shared or when the report's shared, I can do a bit more of a dive into those. However, the report didn't just find good things, unfortunately. We also found that social prescribing for children and young people as a model is not as well developed as it is for adults. So the funding models aren't consistent and sustainable. There's no one route to funding a social prescribing service for children and young people. We also found that staff and link workers and also organisations in the community don't always feel confident that they can safeguard children and young people and provide the level of support that they need. So we also found that community organisations and voluntary and community sector organisations aren't always well equipped to meet the needs of children and young people. There wasn't always a consistent understanding of what social prescribing is for, and the need for community services for children and young people with which could provide a social prescription. There's not consistent referral criteria, and we also found that there are no consistent outcomes measures that capture the true value of social prescribing more widely than just the immediate mental health and well-being impacts. And they don't necessarily capture the value of those community services and of the link worker role. So this has been a very, very quick run through of the report, and I'm really happy to answer any questions on it. And I'm also really happy to share the report in more detail. But essentially, Barnardo's is recommending that the government create a national cross-party strategy for children and young people's social prescribing to ensure that we've got pooled collaborative funding models that are consistent and sustainable, to make sure that link workers have the training that they need to support children and young people, and to make sure that there are a consistent offer of voluntary community sector and other organisations providing the kind of services that could be available on social prescription, and that they have the tools and the confidence and the training that they need to meet children and young people's needs. The report also recommends a consistent referral criteria for social prescribing for children and young people to make sure that inappropriate referrals aren't received and that organisations aren't expected to deal with a level of complexity or acuity that they're unable to manage. We also recommend the creation of a consistent outcomes measure. And the final recommendation that we believe should be in the strategy is incorporating green and blue social prescribing into that wider social prescribing conversation for children and young people. So I think one of the key things I wanted to do while blasting through with a limited amount of time, sorry, I'm nearly there, was to just think about how libraries connect to social prescribing to children and young people and to the report. So I think one of the things that we found doing this research was that community connection is a really crucial pillar in social prescribing from our perspective. Children and young people have been isolated from their communities during the COVID pandemic. Many still face barriers to accessing community organisations or to after-school clubs due to budget cuts, the impacts of the cost of living crisis on child poverty, transport links, anxiety or physical disability. However, community is also key to promoting social connection, making sure children and young people feel safe in their communities, promoting activities that support healthy development and well-being, and the voluntary community sector and other organisations, including libraries, through both direct and indirect methods, do offer physical and mental health support that prevents a clinical need occurring. So what role can libraries play in social prescribing for children and young people, and how can you make sure that your service is set up to do that? Libraries are spaces that hold a lot of potential for children and young people social prescribing through both acting as a space where link workers can be based, through providing some of the activities that are available on social prescription, and through hosting children and young people and families, and also acting as referrers, thinking about that population who visit your library, if there are any changes to that child's circumstances or to that family that may prompt a referral to social prescribing. Getting involved in children and young people social prescribing is getting easier. I understand that, you know, building a relationship with your local PTN, understanding where local services are and engaging with that can be really difficult, but it is getting easier through being able to contact PTNs as children and young people social prescribing becomes more developed. And also I would point people to, and I'd be happy to share a link when it's published, but the Youth Social Prescribing Network is an organisation who are currently developing a toolkit for social prescribing for children and young people that will target both referrers, will target link workers, and will target local organisations to support them to put best practices in to make sure that they're supporting children and young people. And finally, this slide shows some questions that you might be able to ask yourselves internally, or just ask yourselves on this call, to be honest, to consider how you might make your space more accessible to children and young people and their families, and in turn to become involved with any services or collaborate on social prescribing. I won't list them all as I realise that I am out of time and have really blasted through that, so I'm just going to stop sharing.
Thanks so much, Becky. That was amazing. So Sonia was just asking about blue and green social prescribing, what that actually means. So there are some Tola's definitions in the chat, but and then there is an NHS definition as well. So, but thank you, Becky. That's fascinating. I'm sure there's lots libraries can do to really support social prescribing for young people, and we really love to talk to you more about that, I think. So yeah. Just hand over to Tola now.
Sorry, I was trying to put the link to the NAS website in the chat, but I will do that. Thank you so much to our speakers so far. It's been absolutely wonderful. It's my wonderful pleasure now to hand over to Julie O'Neill and Emma Drew, who are going to tell us about how they have been working together to promote health and wellbeing in Brighton. So I think I'm handing over to Emma first, is that right?
Fine with me. Thank you, Tola. Hello, Julie, again. Nice to see you today. And thank you, everyone, for having us here. This is a great event. I really feel like I'm among friends. Bit about me. I think I've got 5 minutes. So I didn't bring slides, although I do have some about our work to share afterwards if anyone would like them. I run the Robin Hood Health Foundation in Brighton and Hove, which is a social prescribing charity that employs link workers funded by the NHS, but it also does a lot of wraparound activity that is completely integrated with the work of the social prescribers. So we're a bit unusual in our model, but it's highly effective. We are based inside a GP practice, excuse me, sorry. We're based inside a GP practice, very forward-thinking, progressive place called wellbeing. And one of the GPs is also one of our trustees. And I was asked to respond today to a couple of key questions. One is about, you know, from our experience, what thoughts could I offer on how libraries could help with local health priorities? And the other question is about how librarians and libraries can connect with social prescribers and GPs. Other people have already pointed out that can be really tricky. So I'll try and share some of our experience. Hopefully some of those things are useful. Some of it you may already be aware of, but you know, if there is something I say that you want to try in your own setting, very happy to talk with people afterwards if they want to sort of pick my brains. I've just been able, thank you Arts Council, to be able to employ some new staff, so I'm a bit less run ragged than I have been historically, so that's very exciting for me. Thank you very much, Arts Council. In terms of what libraries could offer to local health priorities, the first thing I would say, and it should be a publicly available document, is familiarise yourself with what the local health priorities are. So we know that there's an NHS 10-year plan, which is actually great. A lot of health service staff may not have read it, but actually it's really good and really supportable, and does incorporate important thinking that could give a role to libraries, which is terribly important. There are practical barriers, and I'll come to that. And then locally, I'm not quite sure how it's working in different parts of the country, but locally to us, our commissioners are currently developing a 5-year plan, looking at mental health, social prescribing, and a bunch of other things. And that's due to be published, I think, after Christmas. And we've been trying actively to feed into that process. I've no idea if what we've been saying will stick, but I certainly hope so. So if there is that kind of strategic thinking going on in your part of the world, try and get yourselves invited to those meetings. And the commissioners don't always respond to their emails, but there should be a way to connect, and your local integrated care system website should have some information about what local health priorities are. I mean, in our neck of the woods, we have very, very high levels of poor mental health, very, very big problems around housing, which is both expensive, overcrowded, and of very poor quality quite often. Most people live in flats, and a lot of people don't have access to outdoor spaces. Very significant issues around money and inequality. We're the 4th most unequal city in Britain. So in that context where everybody is got more work to do than they can cope with, and that doesn't just apply to the NHS, it also applies to the charity and community sector. You know, how are we strategic? What is the sort of libraries offer that I personally feel has been so beneficial to us? And I should come clean here. I'm not from a libraries background, but I've been working alongside libraries and the Reading Agency for 40 years. Get me. And they are consistently brilliant. The kind of quiet, brilliant innovation that libraries have offered, being able to respond to what's going on in the world, you know, technological innovation, that brilliant local knowledge and local connections, those are huge assets. And I, for one, I'm hugely grateful for the work of Julie and her colleagues, because they do amazing work. They're brilliant. So some practical things. What do libraries offer that the health service might want to kind of connect with? You offer safe space. For a lot of people that we work with, the only place they feel safe is either at home, sometimes not there, if they have a home, and their GP practice. So a lot of the work that we do is in GP practices, but we always know that we will be well catered for, that our patients, clients, people will feel comfortable in those spaces. They will be made to feel welcome. You shouldn't underestimate how important that is for some of the people that we work with who are terribly vulnerable. You offer information resources, of course, you know, directly around health. How brilliant is that? But also the cultural resource, which is actually the bit that we're more interested in. And we have a very strong creative programme, which we're now being funded to roll out to areas of disadvantage around the country. And the cultural resource that the libraries represent is magnificent, and it's free, and it's everybody's. There isn't much of that sort of thing left in the world, and it's vital. I mean, we've been working, for example, from day one, which is sort of over 10 years ago now, with using creative writing with people in recovery from alcohol and substance misuse. We found that a really powerful well-being platform. You know, we can see the impact, we can see the changes, and we get amazing feedback from people. And so we have on occasion, including with the Thriving Communities pilot, run a creative writing group in a library. It's a no-brainer. You know, you already do this stuff. You know, there might be some adaptations and some thinking about training to work with super vulnerable people, but you can already do this, basically. The staff themselves, hugely knowledgeable resource, and very expert, very professional, very welcoming. That really matters. A lot of the people we're working with have had to tell their story over and over and over again. They've been turned away from services. They're not getting their mental health support needs met. But if you create a safe, warm, nourishing environment, people's own recovery processes will kick in and they will trust you. Somebody mentioned trust before. I can't tell you how important that is. We spend a lot of time one-to-one through our link workers building that trusting relationship with people whose trust has been destroyed. And in our case, that includes refugees and asylum seekers, of whom we have rather a lot on our patch. The other thing, which, and this might sound a bit left field, but I think it's actually quite important. The other thing that you can offer is an efficient community-orientated management model. As we know, the NHS is in a state of perpetual revolution. I think the kind of quality of management that I see in my colleagues in the library services is fantastic. And I think our NHS colleagues have a lot to learn from that. I've spent quite a bit of time, I know I'm among friends, so I can mention Dickens. If for those of you who've read Little Dorrit, you may remember the Circumlocution Office, which is the most important department of government, and its job is to talk to itself. I don't see that in the library services. I see a real community focus, really strategic alignment with what's going on, with the skills of the staff. I think, for me personally, as somebody who's running one of these programs, I can't tell you how valuable that is. And I think sharing some learning around that would be brilliant. So to sort of move on to how libraries might connect with GPs and social prescribers and commissioners as well, actually. There are some sort of tactical things you might want to consider, and also some more strategic type things. So in no particular order, I'll just kind of whiz through some of those, and I'm very happy to take questions either in this session or out of it around anything that I might have to say. Communications within the NHS are quite fragmented. The interoperability of systems is quite fragmented. People struggle with their workload, and my experience is that the clinicians are on board with this, the doctors, the nurses. One of our key referrers in is actually a phlebotomist, because she gets to spend a bit of extra time with the patients while she's doing their bloods. So opportunities to invite your health colleagues into the library service is really good PR, and also would benefit them. So for example, a couple of times now, we have taken groups of patients to visit the rare books room at the Jubilee Library, which Julie works at. And actually we had people with tears in their eyes. The librarians were so kind. They put out a magnificent display of the most amazing materials. And somebody actually said to me, they did this for us. They couldn't believe the kindness or the welcome they received. They didn't know that, for example, they could access stuff online. We all assume everyone knows that. It's not universally true. And the fact that somebody took the time and care to share the information and show what the libraries had to patients, to library staff, trying to go to them, as you will have found out, some of you I'm sure, there are loads of barriers. Getting through to people is very difficult. Inviting them to you and showing what the benefits might be in terms of saved time, staff well-being, those kinds of things, that's all really helpful. What else can I suggest? Something we've been doing twice this week, actually. Sometimes while you can't communicate within the system, you can communicate around it. So on Monday, I did an interview with ITV Meridian News, which was an opportunity to talk about green prescribing. So that was very helpful. And also then, of course, you're communicating with NHS colleagues, of whom there are a lot, but also you're communicating with patients. So if this conversation comes up at the practice and the GP says, oh, there's this brilliant green prescribing scheme, our library's got a garden, do you want to go there? The patient is more likely to understand what it is and is more likely to be receptive to what they're hearing. Because some of this stuff is still very new to people. And people have become very, because they're fearful for themselves, for their own well-being, for their families, they've become quite reliant on that conversation with the GP. And part of the confidence building part, enabling people to feel a bit more confident about managing their own health and well-being, is showing these places are safe, they can be trusted. And if you take care over that process, you'll get the kind of results that we do. So we use the outcome star as a sort of measure. Lots of different measures are used all around the country. But what we saw last time we did a snapshot was that 89% of the people coming through our programmes reported significant improvements in confidence and managing their own health, wellbeing and symptoms, and 94% felt improved mood and more connected in the community. That's what we're after. That's what we're all after. That's what social prescribing is all about. There are a couple of other things you might want to think about. There's a big drive within the NHS now to make better use of NHS data. So looking at the population health level, and that will be informing, you know, local health priorities, going back to where we were. And it's really useful to understand what's happening with that data. I mean, it's a relatively new approach. We've been working on a pilot around people of colour who also have housing issues and finance issues and a mental health diagnosis. We've been doing that for 4 years now. And what we were able to do with that...
Sorry to interrupt. I'm just conscious of time. So
okay.
Just to
sure.
to interrupt you because it's
inevitable.
Really...
I can talk for England. Sorry. Yes. I'll just finish this one little point and then I'll finish.
Thank you.
So we can use that data in real time to design our programmes and make them directly relevant to what the clinicians are seeing in the practice. So I would say you're going to continue to find problems communicating with your local PCN or with your commissioners. Don't give up. It's about finding the right person and perhaps inviting them to you, I would say.
Thank you so much, Emma. And just hand you over to Julie, are you now? So that's
yes, that's right. I was just about to do that, but yes, if we can hand over to Julie now. Julie works at the Jubilee Library in Brighton.
Hello, I'm here. Can you see me? The screen was black.
Yes, we can.
Oh, right. Okay. Lovely. Right. Okay. Thank you, everyone. Yes. Hello. I'm Julie. I work for Brighton and Hove Library Service, and I'm a library services manager. My role includes community engagement, health and wellbeing, and I also manage our library home delivery service. So I'm going to talk a bit about the social prescribing sort of background in Brighton and Hove and the kind of things that libraries have been doing, including, of course, working with HERA and the Robin Hood Health Foundation that Emma's just been talking about as well. So I'm just going to try and hopefully share my screen with you now. Oh, good. I'm going to say it worked earlier. Good. I can see it. Hopefully you can see it as well. So I've actually been involved in social prescribing pretty much since it started in Brighton and Hove, which was actually in 2014, if you can believe that. We had a pilot project that was run by a voluntary sector organisation called Impetus, and they mainly focused on social isolation. They led a social prescribing pilot which worked with 16 of the city's GP surgeries, and these surgeries were given the option of referring patients to a social prescriber. Now, 10 years on, Impetus, who are now called Together Co, lead and coordinate a citywide social prescribers network that libraries are a part of. Local residents can now directly self-refer into the social prescribing hub, as well as being referred in by a GP, a local agency such as a library or a community group. And there's also a project now called Social Prescribing Plus, which supports people from Black, Asian or minority ethnic communities. Now, libraries have supported the health and wellbeing of their communities for many years in a range of different ways. So we're ideally placed to support people who might be feeling isolated or who need help to access other services, community groups or activities. Some of our library customers are quite vulnerable and may not feel confident in approaching their GP or an unfamiliar organisation for help. People who are regular library visitors often get to know library staff and sometimes talk to them about their troubles. our staff lend a sympathetic ear and are often able to link people into sources of help. It's not just staff in our libraries that are able to do this. We also have a library home delivery service, and our staff and volunteers can also signpost their clients into helpful organisations and services. So I've been going to our local social prescribers network, as I say, for a long time now. They have quarterly meetings, which is really helpful to libraries because it enables us to find out more about what other local providers can offer residents. I can then ensure that this information is made available to my library colleagues. It's on our online staff hub, and colleagues are then able to access it easily and are better able to help signpost customers. If needed, sometimes a member of staff will make a call on behalf of a customer and put them in touch with a relevant agency. And we have had various times when social prescribers have met clients in libraries to talk through their concerns. Now, participating in our social prescribers network is mutually beneficial because it also raises awareness with other agencies of what libraries can do to help. Social prescribers often suggest that their clients visit libraries because they know that we provide a free and welcoming, warm space, and that anyone can come into a library without being a member. You don't have to spend any money or talk to anyone if you don't want to. Most libraries offer a range of drop-in options for people who want to socialise or participate in group activities, such as board games, knitting, or doing a puzzle. Others don't necessarily want to engage, but they can sit and read, use the free Wi-Fi, or just watch the world go by. Obviously, we're libraries, we have books, we lend information books, so that enables people to read about their symptoms and inform themselves of possible solutions, which often gives them the knowledge and confidence to help themselves. The National Reading Well initiative, led by the Reading Agency, reinforces this area of work by identifying effective health titles, consulting with health professionals and people with lived experience and their families and carers. Libraries can make these books available and introduce them to customers as tried and trusted books to help with mental health and other conditions. And there are now Reading Well collections for every age, children and parents, young people and adults. Now, reading fiction, of course, is vital for libraries and their customers, and that can be a wonderful way to escape your problems for a while and give yourself a break. There's also a national mood boosting book initiative where readers recommend books that they've really enjoyed, and book lists are created and shared online and through libraries with book displays and book lists. There's even a word, bibliotherapy, which is the art of using reading and writing as a tool for managing well-being, facilitating self-development and providing psychological support. Research has shown that engaging with literature and the arts can be very effective in helping to support people's health and well-being. So this is where libraries got involved with HERA and the Robin Hood Health Foundation to work to basically encourage people to participate in the creative arts as a way to support their well-being. A lot of this has been done through a project called Prescribe to Thrive, which involved a whole range of health and well-being partners as well as libraries. And the project aimed to use social prescribing to improve the physical and mental health of 100 adults and young people living in the west side of the city. Social events were promoted and held at a local GP surgery on Saturdays, and everyone in the local community was invited to eat lunch together and suggest activities they'd like to participate in. A range of activities was then put together for the project, which social prescribers and community organisations were able to offer to residents who could benefit from them. Prescribe to Thrive strengthened and expanded community partnerships and enabled closer links to be made between libraries and GP surgeries in the west of the city. The library offer was promoted via GP surgeries, and libraries were used as venues for some of the creative activities offered. Following on from Prescribe to Thrive, 2 visits were organised for patients who had participated in the project to visit the Central Jubilee Library for a tour and a talk about the library's rare books collection. The visit included the opportunity to see examples of the rare books, including illuminated manuscripts, miniature books, and the notorious book, which it has been claimed is bound in human skin, which is the one on the top right of the screen. And the feedback from participants was very positive. Brighton and Hove Libraries is currently in discussions with UOK Brighton and Hove, which is an umbrella organisation for mental health support agencies in the city. And the intention is to provide a weekly drop-in service at Jubilee Library, where people can come to access support for their health and well-being. So hopefully this will go ahead as planned, and we'll continue to work with other local agencies and social prescribers across the city and grow and develop our offer to customers. So thank you very much. That is me finished.
Oh, thank you so much, both Emma and Julie, for those presentations. They're really, really informative. We haven't really got time for any questions, so I just put it in the chat. If anybody has got questions, I put my email in if you want to email me, and then I will forward those questions on to our presenters and we'll be able to get back to you with answers. I'm now going to hand over to Tola, who is going to close today's presentation. Over to you, Tola.
Goodness me, I didn't realise that I was so absorbed. I didn't realise what the time was. So I just wanted to say thank you very much, first of all, to all of our speakers for giving us such wonderful examples of